Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Bridget Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time.
Hi, everyone. Welcome back to the Functional Nurse Podcast. This is Samantha Hamilton. I am our Director of Growth and Partnerships here at the Institute for Functional Nursing, and we have a very special podcast episode for everyone today. We are talking with some of our nursing professionals that are from Canada, because we get a lot of questions from nurses just asking, how does functional nursing apply when you're in Canada versus in the States? So we thought we'd bring some of our faculty and students in to just interview and ask a few questions. Thank you so much for joining today. So the first person I'm going to introduce is Megan. Megan is one of our faculty members, and she's a nurse practitioner currently working in Canada. What are you doing right now with your career?
Thanks, Sam. And thanks so much for having this podcast with us Canadians, because it makes us feel like we're not a forgotten part of the world. I am a nurse practitioner practicing functional medicine based out of Ontario. So I did my IFM certification, I believe it was back in 2020. And since then, I've opened up my own functional medicine practice, working primarily with women on gut health, hormones, and nervous system, and the connection between everything that's going on in our body. And it's been such a dream being able to live out this practice and to be able to share this knowledge and education. I also am faculty. As you said, I work as faculty for the Institute for Functional Nursing, and I feel so thankful that IFN exists because it is such a great resource for nurses out there, no matter where you live. If you're interested in functional medicine from a nursing perspective, it's really great. So I primarily have a virtual practice, as I said, based out of Ontario, definitely with a special interest in gut health and hormones. But as you know, when you look at functional medicine, it's not just about like one or two things, it's about everything. And my favorite question is why?
That's something that I feel like a lot of nurses that I talk to have in common. I actually talk to a lot of ER nurses and ICU nurses, and I feel like that's because a lot of times our specific personalities are like, but I want to understand why this is happening, or why are we starting this medication, or why are we making this vent change? So I think that's pretty common in people who end up finding their way towards functional medicine. So next I have Tabetha. Tabetha is actually one of our students in the functional nursing program, and she was on one of our podcast episodes a few episodes back. She's an RN. So Tabetha, do you want to just give us a quick rundown of what you're doing?
Yeah, so right now I live in Alberta, Canada. I work for the provincial healthcare system. Most people that I know do. I work in home care, so very community-based, working with a lot of seniors, but kind of all through the adult lifespan. And yeah, I had the opportunity to join the very first cohort of the IFN program and have been loving it. So finished semester 1 and just gearing up for number 2. So I still feel like I'm in the baby stages of learning about functional medicine and how to apply it to my everyday practice. But I really love it because I feel like it ties a lot of the things that we learn in nursing school to every day, getting back to the roots of what makes good health, and before we intervene in any kind of other medical ways, when we can, how can we deal with things before that? So I feel like there's lots of really cool ways that it can apply to public healthcare practice as well. I mean, obviously we have the confines of time. That's probably one of the biggest limiting factors that makes it kind of challenging to implement. But I think we always have a great role for education with our patients and clients, as well as advocacy. So that's been really fun to dabble in a little bit as I've learned things that I've been able to help do some nutrition counseling, just kind of basic things, or even just giving clients questions that they can bring to their primary providers. Exactly what, like Megan was saying about medication, like why are we taking this? Or are there other options? Or just things like that I feel have been really fun to kind of try out and help my patients learn about too.
Yes, exactly. And for anyone who didn't listen to or didn't get a chance to listen to the episode where you were interviewed on the podcast, can you just tell us what drew you to functional medicine, or how did you find functional medicine?
Yeah, I think there was kind of two reasons why I was especially drawn to it. I listened to the podcast for quite a while before finding the program, but it was kind of two parts. First part is just feeling a lot of burnout after the pandemic and not feeling like nursing or what I was doing was really aligned with my goals or kind of vision for what I had just thought that nursing would be like for me. It wasn't feeling like that anymore. Debating a career change, either something totally different or going back to school to become more specialized or something like that. And then the other piece I think was also just some of my own health struggles. I know I talked about in my podcast episode where we talked about just some infertility issues and kind of things like that. And so that was also part of what kind of spurred me into learning more about functional health and just some of those non-medical interventions that can really support people and make a huge change in their everyday life.
Yeah, for sure. I talk to so many people who are drawn to functional medicine either to help heal themselves or heal their family members, or just they didn't get the results from the Western medicine model of care that they had hoped for. Thank you, Tabetha, for introducing yourself and telling us. And then our last guest on the podcast, this is Matt. He is a nurse practitioner who is also in our program, and he is located in Canada. Can you give us a brief intro?
Yes, so my name is Matt, and I'm a nurse practitioner in Ontario, Canada. So I've been an NP for 5 years now. I started off my career in primary care with a big focus on addictions care and mental health, chronic pain, as well as chronic illnesses. And 3 years ago, I transitioned to palliative care in the community. So that's what I'm currently doing, practicing strictly palliative care in the home care setting. After 5 years of being an NP and seeing the spectrum of disease from, patients in primary care where maybe they're relatively stable to seeing patients with a terminal illness at the end of life, really started getting me thinking about approaching patient care differently, because from my experience in primary care, I just started asking questions like why, like Tabetha and Megan were saying, you have patients that show up with symptoms, and usually it's like, for example, most of the time somebody shows up with a gastric reflux. You might do some investigations, but often they end up on a stomach pill or such as a PPI. And we don't typically ask, why is this happening? Right? Just having this curiosity from my experience and wanting to know exactly like, why is this happening and why was this not a problem 5 or 10 years ago? And now it is. It's not only because of age, right? So I started looking at functional medicine, having a different approach, root cause care, and decided that it was time for me to jump right in and start learning.
I love that. And I feel like there's so many people out there who they want to know the why behind what their clients are experiencing. Like, why does this person keep coming in for the same issue? They might get a prescription for a medication for whatever symptom or dis-ease that they might be experiencing. And then because of that treatment that they were given, now they have another symptom. So now we have another issue that we need to work with. So I love that being in that primary care setting, it kind of triggered you to be on that same wavelength of asking that why question. And Megan, I just want to circle back to you. I never got the chance to ask you what drew you to functional medicine. How did you find functional medicine?
I think like everybody, it is when you work in the healthcare system, you recognize that repetition and wanting to do something different and actually help people heal. But of course, we always have our own personal health experiences. I definitely had some of my own health experiences. The biggest one was literally being hit by a truck while I was walking into work. I think actually I talked about it when I did a podcast with Bridget before. Essentially, it was like I was walking into work and a guy ran a red light, and my life literally changed with that. I obviously went in as a patient in that situation and also really had to look at my life in a different lens to think about, how do I want to live? What does my life look like after this accident? And then also meeting the resistance of being a patient in the system and not getting what I needed. So a lot of it being like medications being offered and me having to realize like I have to advocate and I have to look for a different pathway. I had always been interested in more, like I would call them more natural approaches. But when this happened and I had to start looking deeper, and then it suddenly led me to functional medicine. I was like, what the heck is functional medicine? And that essentially I signed up and did the applying functional medicine in clinical practice through IFM. I was just like, mind blown. How did I not learn this in school? I just thought this is what I need. This is what I want to do. And I think that was the first time I really, really felt lit up like that. It has continued. So it's one of those things, the more education I receive, the more I learn. It's just expansive. That's how I got on this path.
Yeah. I feel like a lot of times people who are interested in functional medicine are kind of those like perpetual students, you might say, where it's like you're always learning something new, and it's just so like refreshing to like keep learning new things, which I just think is awesome because there's always something that you can learn about like preventing illness, working more towards health on that like wellness continuum. So that's really, I love your story, Megan. Anyone who's not familiar, the Canadian healthcare system is different than the healthcare system we have in the States. Would one of you guys be willing to tell us about the healthcare system and how it's different, maybe?
Yeah, sure. I can go ahead. So the healthcare system, like you mentioned, it is different in Canada compared to the States. So we have publicly funded healthcare system that is funded provincially. Each province is in charge of their own healthcare system. And for most services that are needed in terms of conventional medicine is covered. So for example, if you go to the emergency department, your regular primary care provider visits with either your family doctor or nurse or primary care nurse practitioner, like those visits are covered. Majority of imaging and labs are covered too, like your regular conventional labs. There are a few labs that are not covered, but if you need a CBC and A1C, like liver function test, kidney function, etc., most of that is covered. The only thing that's not always covered is medication. Therefore, it's either people pay out of pocket or they have their private health insurance that pays for it. And in Ontario specifically, you can get your medications covered up until the age of 25, I believe, as well. What's not covered is typically like your physiotherapy, psychotherapy, like you need to see a speech language pathology. Those type of other services are typically not covered.
And then the person has to pay out of pocket for that?
Yes, they pay privately or they have either like health insurance that may cover some of those services as well.
Okay. I wonder if that would be similar to like how in the States we have like a supplemental insurance where you can almost have like an additional insurance in case your insurance doesn't cover what service you need. So in the States, our healthcare system is largely reactive. It's really great if you have some type of an acute issue, like if you get hit by a truck or you have appendicitis or you have an infection and you need to come in and get IV antibiotics. But I would say that an area that our healthcare system is lacking is in that preventative part where like we're preventing different chronic conditions from happening. And then we start to treat once there's a chronic condition, and we're not necessarily trying to reverse it at all. So would you say that your healthcare system is similar or is it different?
I would agree. Ours is similar. I think sometimes it can be even potentially more reactive and less preventative because it can be harder to access services. So that's one of the downsides, I would say, to having a publicly funded system is you don't necessarily have as many services as what you need. So there can be some frustration depending on where a person lives. It could be that you call your doctor's office, but there's no appointment available until next month. Then by the time you see your doctor, maybe you've already had an emergency situation develop, or if sometimes too, a common issue or complaint I hear from patients is I went to my doctor and I asked about, doing a little bit of a preventative health check and getting blood work done. And they told me that's not necessary, or we'll just watch your A1C until you have prediabetes or diabetes and then we'll take action. I think it definitely can vary depending on potentially who your primary care provider is. Some people are going to be a little bit more taking that proactive approach, but I would agree with you, Sam, that probably Canada is very, very similar in the way of not having a lot of a preventative approach. As much as, we're taught that in school, I think, as nurses, we're taught to practice that way, but it becomes, is that actually what's implemented? And that's my experience. I don't know if you guys, Tabetha or Matt, have a different perspective on that.
I feel like when people are looking for more like preventative medicine, right? Because that's really what functional medicine is, to try and optimize wellness. When people are looking for that type of knowledge, education, I don't want to say treatment, because really the client themselves, they're their own primary care provider in the lens of functional medicine. If someone is looking for preventative care, functional medicine in Canada, is it the same kind of thing where they need to just kind of go off on their own and find a practitioner?
From my understanding, yeah, because the way it works is usually people, they won't have the information that they need. Often people want more information, right? And then they start looking at who can provide this. And I think it's important to have a good healthcare professional that's based like in functional medicine, because like an example is in primary care, like you said, is very reactive. There might be a bit of preventative care, but it's very minimal. So for example, maybe somebody's pre-diabetic, they have an A1C of 6.1 and they're told they're pre-diabetic and they need to maybe eat a bit better and exercise more. But there's only so much that can be done within a 10-minute appointment, right? So people either like they go home and they start looking online for information, then they get overloaded with what to do because nobody knows how to exercise and what to eat anymore, right? So I think this is where kind of like a good functional medicine provider based in evidence-based medicine to provide individuals with the right information about what to do and a bit more of guidance on the right approach and to do that, a lot of that education part.
Yeah, definitely. And that's how it is here in the States too, is that to try and get that education, that coaching, you really can't find it in the Western medicine model of care. So I'm curious, what opportunities are there for nurses who live in Canada, nurses, nurse practitioners, to use or practice functional medicine? Like, does someone need to start their own business? Are there integrative health clinics out there? Do you feel like you can incorporate it even with, like, I know Tabetha, you said that you're working in the healthcare system. Do you feel like you can incorporate that knowledge in your current role?
I mean, I think there's definite opportunities to incorporate it into your current roles, especially if you do have an opportunity to provide patient education or advocacy for people. I don't know that like people working in the hospital setting really have a great ability to do those kind of things, but in community, there's definitely more opportunities. But I think really to fully explore it, private practice would probably be a better option. And I mean, there are, like Alberta's been kind of slow on the uptake for nurse practitioners as primary healthcare providers, but in the last couple of years, they finally started to integrate that more into primary care. And so I think even working under a nurse practitioner might be a different opportunity where there's definitely more opportunities for that kind of education because it's more what a nurse practitioner is specialized in, which Mat and Megan can probably speak more to.
I started using functional medicine approaches while I was working in primary care in a publicly funded system. And it was definitely possible to implement some of that, but there were still limitations, I would say. So it just depends on the depth you want to go. Because if you're going to do the full, like, I'm going to do a timeline, I'm going to do a matrix, you need more than the brief appointments that we have allotted. I found there were a lot of people that were finding out, hey, if you go see Megan, the nurse practitioner at the clinic, like she'll take time with you and she'll talk to you, but then everybody is walking in the door expecting that. That's a really challenging thing to do. However, I think sometimes we can also look at it through a different lens of like, maybe you don't do that full approach, but maybe you have the conversation like with the person, like Mat had given the example of someone coming in with reflux. Maybe you have that conversation and say, let's do a diet recall, or what kind of things are you drinking alcohol? How much coffee do you drink? Asking some questions. What's your stress level like? How are you sleeping? Because those things, how often do people get asked those things in a medical appointment? But those are pretty simple things that if you ask those questions, I still remember one guy I asked when I was working in primary care, I asked him about his coffee drinking and he's like, well, I drink quite a bit of coffee. And I was like, how much coffee is quite a bit? It turned out he was like waking up in the night to drink coffee to go back to sleep. He would wake up because he had a headache from caffeine withdrawal. If you ask the question, you might actually get an answer. And also things even like, for instance, like Mat was talking about what's covered for our labs. Like, for instance, vitamin D is not covered. So not everybody will get that checked, but a lot of people don't even get their B12 checked. So having even those simple things where it's like patients may not even have the thought to ask for it. They just think, I'll just ask for some blood work because I'm not feeling well. But having even conversations as a nurse with a patient saying, if they're in the emergency department, you've seen them a number of times with headaches, for instance, saying, hey, have you ever had your B12 checked? Have you ever, asking some questions like that? Because when you go into the emergency department, most likely they're not going to check your B12 levels. Sometimes you might just be able to throw out like little bits of advice that I've heard people walk out of situations like that, patients that are just like, no one's ever asked me those questions, right? And it could be something as simple as, yeah, how are you sleeping? What are you eating? So sometimes we can just make it a little bit more basic still. And it's crazy how sometimes those questions don't get asked.
It sounds like that's pretty similar to how it is in the States. Even just being like at the bedside with people, you can just drop the idea of something like you were saying, how much coffee are you having? Something that might seem so simple to us. Our brains are thinking through a timeline, a matrix. Can I do a GI map? What's going on with your gut? And I feel like oftentimes if we just like scratch the surface and change that perspective or that thought process for the client, that they might be like, oh man, you're right. I do drink a lot of caffeine. Maybe that's something I should work on. But I think that that's really interesting. I know, Megan, you had mentioned that you thought there was some integrative clinics that people could possibly work at as a nursing professional. Your own practice, it sounds like.
Yeah.
Like you have your own functional medicine practice.
Yeah. And I think it's probably an area I think is going to continue expanding, but I have spoken with other nurse practitioners, for instance, involved working in more like integrative clinics in the way of having naturopaths available or a team where it's, different services. Say maybe there's like a dietitian or some nutrition coaching. But yeah, I think that there is potential for it. It's probably less frequent and you probably have to dig around. I know I do get a number of nurses that email me and are like, how do I do what you do? And honestly, it is a big leap to take that jump and go full in because again, in Canada, people do sometimes have the perspective of I get healthcare for free, so why should I have to pay someone? But people are also frustrated at the level of healthcare they're getting, so they're wanting to invest in their health.
Right. I feel like it's the same way here, where I think once someone gets to that point where they are committed to improving their health, that's when they're willing to make the investment. And oftentimes that's when people are going to see success, is if they have some type of a stake in the game. And Matt, now I know you are enrolled in cohort 2. You're going to be starting here in August in our first semester of the program.
And now a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short, on-demand contact hour courses to the full functional nursing program designed specifically for nurses and nurse practitioners ready to practice root cause, whole person care. And if you're looking for connection and real-time learning, the Functional Nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode.
Do you have any thoughts on how you want to incorporate the knowledge that you're going to gain into your career?
So initially, I don't think palliative care is the right setting to incorporate functional medicine. And maybe it is, and I just haven't found that yet. But what I do plan on doing is eventually down the road, I would like to open up my own practice, probably virtually to start off with. Until I set up my own practice, I'm not exactly sure how I'm going to incorporate this. Perhaps looking for some integrative clinics that are maybe looking for a practitioner in functional medicine and maybe getting started in that aspect to get the experience and work in like more of a team-based setting to start off with, I think would be good because especially when you're new at anything, it's always good to have a mentor, right? Because I remember starting as an NP, I was working in a primary care clinic and I was working with 2 other NPs that were much more experienced than I was at the time. It was very helpful to have that mentorship, that guidance, right? I think to start off with, started in maybe an integrative clinic. And then long-term goal is to open up my own clinic and offer functional medicine, lifestyle interventions, and hopefully hire more NPs and RNs and offer that full scope of like functional nursing down the road. So
I love that.
That's my plan. Yeah.
That's amazing. That's a lot of nurses who learn about functional nursing. They're so ready to get out of the healthcare system because they're like, I know in my heart that my way that I'm going to change the world with this information is to do it on my own. You're kind of right along with what a lot of other people think.
It is exciting and scary at the same time because the thought of just being self-employed is definitely scary because as nurses and nurse practitioners, we don't necessarily think about a private practice, right? It's different if you go to massage therapy school to become a registered massage therapist. Well, most do already work in a private practice, or even physio. There's a lot that are in private practice, but nursing, we typically don't have that in our mind that it is an option. But I'm looking forward to learning about like the different aspects of becoming independent and owning a business and that marketing aspect and how I'm going to offer certain services and all that. So it's like a big learning curve, but it's also at the same time very exciting and motivating.
It is for sure. And Tabetha, how do you plan to use the knowledge that you're gaining about functional medicine?
Yeah, I definitely would love to explore private practice in some ways. I've kind of already done a little bit of investigating just because I feel like my curiosity got the best of me and I had to find out like how is this possible and what support is there out there from my professional body to like figure out what needs to be set up. So I did some of that already. And yeah, was surprised to find that it's not as difficult as I thought it would be. Yeah, I don't know exactly where that will go, but I definitely feel passionate towards like women's health issues and just feeling like there's not a lot of support out there for women's health and a lot of what does already exist. I mean, especially in like the fertility spaces also is private pay and out of pocket and stuff, even for Canadians too. So people are already kind of used to having to look for private pay options when they're dealing with those kind of issues. I think there would be might be a little more support from the public in kind of going that direction.
And you said that you were doing some investigation towards the like entrepreneur side of things. Here in the States, each state has a different scope of practice. For example, I'm in Wisconsin and it's very, I would say, kind of like plain, just saying that like my scope of practice is AdPi, but I feel like that covers a lot. Now you guys have different provinces, correct? What did you find out in your quest exploring entrepreneurship and being an RN and scope of practice?
Yeah, I mean, I think Alberta's scope of practice at least is pretty broad. I can't speak to the other provinces. I've never been licensed to work in any of those other areas, but it's pretty overarching with education and advocacy and those kind of things. And during COVID, there were some like provisions made too for people who want to work interprovincially that if you are licensed in your province with no conditions or anything like that, they made it a lot easier for people to get interprovincial licenses, that they wouldn't make it a big barrier so that they could attract more help. I think that it must be pretty similar between provinces.
And for you guys as NPs, Matt and Megan, sometimes in some of the states here, our nurse practitioners have to have a supervising physician. Do you guys have anything like that?
Matt and I are both in Ontario, and we don't have to have anybody overseeing us, so we're fully autonomous. And I think, as far as I know, all provinces are at this point. There has been times in the past, definitely, but I would say nurse practitioner role has been like really developing more in the last, I don't know, 10, 15 years. Even when I first started, we couldn't order CTs or MRIs. And within, I think, because I finished in 2016, 10 years ago now. Wow. So but by the time I think I had graduated in Ontario, then all of a sudden, or maybe it was a year later, we were able to order CTs and MRIs. And when I was licensed in Manitoba, we could prescribe opioids. Then in Ontario, you couldn't. And now you can. So it's like this, not that sort of thing is like a necessity. I'm just saying like it's a rule that's constantly evolving depending on the demands, I would say. And I think it's, again, for RNs and NPs, it's one of those things where it's like there's a lot of flexibility depending on what your level of education is. Like in the sense of if you have the training in something, it's a skill that you have. Like even as an RN, for instance, working in labor and delivery, I could do speculum exams, but if you're working in like cardiology, you're not going to be doing like vaginal speculum exams, right? But it just depends on what you've been trained in. There's certain things, obviously, a nurse practitioner role has a bigger scope, but yeah. And I think whatever may vary province to province definitely is one of those things where you just have to check with what the college outlines.
I also want to just put the pin in that it is very important to know that we are not giving any type of legal advice on the podcast. You still need to look into your own scope of practice within your province. These are just things that our guests have discovered kind of on their own through their own experiences. Speaking about scope of practice, I've heard from a few different people that it's challenging to get labs outside of the healthcare system in Canada. Here we have things like Avexia, Rupa, you can get function health labs, and it's really kind of the things that your traditional Western medicine doctor isn't going to check, the more preventative labs. So how do you guys get these type of labs outside of the healthcare system in Canada?
It is definitely without an ordering provider for even just basic labs. It is one of those things very difficult. There are, for instance, some people will go to a naturopath, and naturopaths can order specific labs and testing, and it is paid out of pocket by the patient. In a situation like, for instance, for me as a licensed nurse practitioner in Ontario, I am able to order insured labs for patients, things that are normally covered, kind of like what Matt was referring to before. But then, for instance, if you're looking at getting like more functional type tests, like if you want to do comprehensive stool analysis, or you wanted to do like an organic acid test or comprehensive hormone testing, anything like that, that is where it can get a little bit more challenging depending. For instance, in Ontario, you can order through In Common Labs, which they just rebranded, I believe, to Integrated Laboratory Services. So they're like an Ontario-based not warehouse, but like they're a conglomerate of like, they order from all the different, like they order from Dutch, from Diagnostic Solutions, from a bunch of different places. As a Canadian, you can sometimes also, as a like prescriber ordering provider, so nurse practitioner specific, not necessarily RNs, you can order direct from some labs, but some of the labs, like for instance, Diagnostic Solutions, you can order through them, but they'll redirect you to go back to the integrated laboratory services that I mentioned. But for instance, like I order direct with a number of different labs that are based in the States. So we don't have very many that are like Canadian based. So then you do also have some of the risks of like, I've had some questions and stress over like, what happens if I can't ship something across the border? There was a time where things were actually getting held up, and some of my samples were getting so delayed they weren't getting to the lab in time, just because of things getting like a little bit tighter with customs. So there definitely can be some limitations, and I think it just takes a little bit more creativity. But on the patient end, it can be very frustrating if you don't have a provider that is meeting you where you're at. If you're wanting to go a little bit more in depth, it can be one of those challenging situations where maybe you have a belief that you need a test and you're at the mercy of the person that has to order that. So we don't have anything as of yet that I'm aware of that's like Function Health, for instance.
That's really good to know, because for example, like I'm an RN in the States, and really what I try and pride myself on is providing my client with the knowledge that they need to make an informed decision. And then here we have things like, for example, Rupa, where I could create a cart for my client after I, educated them about, I really think you'd benefit from a comprehensive stool analysis. They go in and pay for it, and then they get the results, but then I also get the results. And then where I come in is helping them understand what the results mean. What is something that you can do to help maybe improve those results? But it sounds like that's a little bit more difficult for an RN in Canada, and that you would need someone who's like an ordering provider to help you do it.
Yeah, that's right. And I mean, I think some of the provinces had started working on different education for RNs to be able to order lab tests. Like I know even in Alberta, they did actually add it to our scope a few years ago that RNs could order diagnostic lab tests if they took some more specialized education. You actually can't enroll in the specialized education unless you have an employer that supports the implementation of it. As far as I know, there's no workplaces that are currently supporting it. It's kind of a barrier it's a possibility, but it's just not really happening yet.
It seems like as an RN who's wanting to start their own business in functional nursing in Canada, you don't necessarily need an overseeing provider, but you need someone that you can collaborate with to order testing for you, or that they can order testing and review with the client to be able to help if you're meeting a barrier of you've already worked on all the lifestyle things, you've done diet modification, maybe you've done an elimination diet, and your client still isn't seeing results. That's when it's good to have some people you collaborate with to be able to get those type of labs. Something that's also a challenge for really within like scope of practice, and again, kind of speaking for myself, is I educate my clients about different supplements, and then they can make that informed decision. Here, you could go to Walmart or Meijer or Walgreens, and there's like 3 aisles of supplements that someone can choose from. And if someone's coming to me and they're complaining of, say, constipation or they're not having enough bowel movement, I can help educate them about the type of magnesium that might be beneficial for their situation. They could go wherever they want and get it. Or I could say, this is a trusted source. Here's where you can get it from. You know what's on the label is in the bottle. How do supplements and supplementation work for you guys in Canada?
Yeah. So, and I think like it's a little bit different as a nurse practitioner versus RN, but yeah, I would agree with what you're saying, Sam. People can go buy from wherever. I always give the disclaimer to patients saying like natural health products are not regulated, so you don't necessarily know what you're getting. So for instance, FullScript, we have FullScript in Canada. It's just a Canadian. Actually, FullScript is a Canadian company, if you didn't know that.
No, I didn't.
It's interesting at conferences, it's always Canadians that are at the booth and they are a Canadian company. But there's Canadian website, US website, so you need different profiles for each. But the Canadian FullScript, you can just, I will say to patients, like, things generally at FullScript have been back checked for quality. Most of the supplements are third party tested. But I say sometimes too, if you want to go buy it at like Walmart or in Canada, Shoppers Drug Mart is kind of like our Walgreens, I guess you could say, you can look at FullScript and say like, oh, what brands do they have there? Oh, those are good brands. I'm going to go pick that up at my local store or your local like health food store, whatever it may be. I would say same sort of situation. I looked at the College of Nurses of Ontario and for RNs, it said something to the effect of, and like, this is not a quote, it's not direct, but something to the effect of like, nurses, RNs can even sell supplements. They just can't be advertising or having false claims or overextending. Magnesium is going to solve all your life's problems. You can't really make a lot of health claims on it, but you could make it as a recommendation and education, like what you were saying.
Tabetha, do you have any advice for nurses who are interested in learning about functional nursing and they currently reside in Canada?
Yeah, I definitely think that pursuing a little bit of extra education is not a bad idea. And I think the IFN has been really great for that. We do have a few Canadians in the program, and as well, Megan is part of the faculty and based in Canada. So that's really cool. I think that like the live streams and things are really good about exploring different options for Canadians and kind of talking about how that impacts us too. So there's lots of room for discussion there. And yeah, I just think there's definitely applications for those who want to continue working in public practice as an RN. There's definitely avenues that you can still pursue educating people and advocating for people in a functional health space. But there's also definitely opportunities for private practice if there's RNs out there who are kind of discontent with what things are looking like right now, but thinking that they have a passion or a vision for functional health in a broader context. There's definitely ways that you can do it, which I think is really exciting.
That's awesome. Megan, as a nurse practitioner who lives in Canada, do you have any advice for other nurse practitioners who are interested in learning functional medicine?
First would be go to IFN, Institute for Functional Nursing, check out the content. Visit also Institute for Functional Medicine. We are partnered with IFM. And honestly, if you kind of just do a little bit of listening, even listening to Bridget's podcast, the Functional Nurse podcast, checking out other functional medicine podcasts, I think is a really great way of just dipping your feet in, like just getting a little bit of exposure to understand what functional medicine is. Because a lot of people, honestly, this is a very new concept for. But once you start learning it, you're like, actually, I kind of might be doing some of that already. I think it's kind of exposure. And then if you're in a situation where you're like, yep, I'm ready, then I would say definitely for nurses, IFN is, if IFN existed when I did my training, like I so would have been on board with it because it's amazing. I know I'm kind of like a little bit biased because I also am one of the faculty. But I truly, like, when I go through the content, I'm just like, okay, this isn't, and I'm like, wow, this is just, it's just follows the right flow. I'm like so jazzed by the content of IFN in in the modules that we're teaching. And the community membership, so good. And I would say if you end up having any other like-minded nurse practitioners that you can connect with, that's also really great because you can help each other realize what's possible. People say you're kind of like the 5 people you spend the most time with. So it's helpful if you can expose yourself to other people. And that's where if you don't have them in your own direct practice area, your city, maybe you have to look at virtual options online, but definitely having that network. And I think, yeah, it's then just kind of seeing what feels aligned for you and moving forward.
What I would suggest is to start with the Functional Nurse podcast, because that's where I kind of got introduced to the Institute for Functional Nursing. And what I really resonated with was the approach and kind of like the philosophy behind the approach to care, because I know there's a lot of programs and providers out there that are maybe very focused on supplements or not specifically like a foundation first lifestyle based, approaching that functional health through that approach. So that really drew me to kind of diving a bit deeper and learning a bit more about the Institute for Functional Nursing. And then I had a conversation with you, Samantha. You answered my questions. And then I did take the introductory to nursing, to functional nursing course. And that really, gave me a bit of a taste of what to expect in the program. And then after that, I just knew that, the Institute for Functional Nursing is where I belong and where I need to learn.
You were in a different program prior to joining the Institute for Functional Nursing in our functional nursing program. What was kind of like your differentiator to choose between like wanting to continue your other program and then choosing to go with the functional nursing program? Like, how did you make that decision?
Right. The other program I took was more of a fast track introductory course to functional medicine. I just found that it wasn't structured appropriately. There was a lot of information everywhere that wasn't really applicable. It wasn't grounded in any framework or philosophy to approach a patient with a functional medicine mindset. For somebody who's new to functional medicine, it was just very confusing. And essentially, I had some of this information and I'm like, I don't know what to do with this. I don't know. Like you need the foundation, right? And that's where having a good framework and philosophy to approach care is very important. And that's what I found with the Institute for Functional Nursing is that it is grounded in that philosophy and framework.
Right. And using the tools from the Institute for Functional Medicine, who is really kind of like the head of learning functional medicine. So just a quick question, Megan, for you before we wrap up, and then I'll kind of go along to Mat and Tabetha. But what makes you hopeful for the future of functional medicine, functional nursing in Canada?
I think there's just so much potential for functional medicine. I feel like in Canada, it's still kind of like a newer thing. And yeah, it feels kind of like endless opportunity because there's so much untapped in the field. So I think in Canada, Canadians are looking for more answers, more preventative health, more education and knowledge on why their health presents the way it does. And functional medicine is really the answer to that. So I feel super excited because I feel like I kind of got on this boat early, and it's this ripple effect where I speak with a patient, they're learning, they're telling their friends, I talk to other healthcare providers. And so more and more people are becoming aware that this is actually an option and it's reputable, it's evidence-based. But I just think we're at the start of something very exciting.
Mm-hmm.
And so being a part of that and the development of this moving forward makes me really excited.
Yes, me too. Me too. And Tabetha, what makes you excited about the future of functional medicine and functional nursing in Canada?
Yeah, I think nurses and nurse practitioners especially are really poised in the position to be able to help people because there's already such a high level of trust with the public for nurses and nurse practitioners, and they already have such a great role for educating patients and advocating for them. And so I'm really excited to be kind of in the beginning, like Megan said, early adopters kind of this type of thinking. And I do think that people are really interested in pursuing different ways to become healthy, and just as things change in the healthcare system and people are just finding that it's not meeting their needs, that there are other options out there. And so I think that's really exciting.
For sure. I feel like we're on the brim. I don't know what term to use, but we are like at the beginning of something that is happening. And it's going to be so big that like our healthcare system is just changing. People want to know how to make themselves healthy. Well, I just want to tell you guys thank you so much for taking the time out of your day and to do this podcast interview with me. And I hope that we have so many nursing professionals out there who find this really beneficial and just encouraging to learn functional nursing to try and work towards that health end of the wellness spectrum and to help clients do the same. So thank you guys so much for being here. I appreciate your time. Thanks
Thanks for having
guys.
us.
Thank you for tuning in to the Functional Nurse Podcast. If today's episode resonated with you, be sure to subscribe and leave a review. It helps other nurses find this movement. To learn more about our programs and join the community at IFN, visit fxnursing.com. Together, we're not just rethinking healthcare, we are rebuilding it from the inside out.